So one of my favorite things about our program and our company is that the hard cases, like, if you're a doctor out there, point the camera, if you're a doctor out there and you have a patient that's been in chronic pain for years and can't get rid of it, send them to us. Like we can get them out of pain. Most likely, I would say that our success rate is incredible. I just published a paper. And I publish small internal papers, so I'm not publishing to the big journals, right?
Mm-hmm.
So, but I mean, I probably could. I just need I need some additional colleagues to, assist in the big publications so that it gets, a reputable representation and they want to publish it or whatever. But I am publishing it for our own benefit to the doctors that work with us and to our networks and stuff like that. But I just published one on neuropathy showing we have a 92% success rate treating neuropathy. And that's something that, and these are patients with, most of them, it's chronic neuropathy. So we only treat chronic pain anyway. So they would have had to be established as a chronic pain condition for us to even treat them in the first place. So it's chronic neuropathy, and we treat it 92% success rate.
That's incredible.
And then of course all those benefits we talk about. I just got an email from a doctor yesterday, and she is a retired MD, and she's actually getting treatments from one of our nurses out in the field. She was like, I just wanted to reach out because I'm 3 treatments in. I've been in chronic pain for years. And she's like, I'm 3 treatments in. My pain level went from 8 to a 2.
Wow.
She was like, after 3 treatments, she's like, my mental clarity is back. She's like, I can think again. She's like, I can actually get around. I can talk to people. I can walk. I'm better. She's like, I'm better. I'm out of pain and I'm better. She's like, all around, I'm better. This is an MD, a retired doctor. And she was like, what can I do to help? I just wanted to sing the praises of the nurse first off, because without her, I wouldn't have even tried it, because she wouldn't have believed it.
Right.
She's a doctor. She knows everything, right?
Right.
Doctors know everything. She wouldn't have even done it had she not been convinced to do it by a nurse who knew her personally.
Uh-huh.
Right. But if I just told her about it myself, she wouldn't have believed it at all. Right. Because she'd never seen it before. Now, I was telling you back in 2017, when I first started coming across this therapy, I didn't understand why some doctors had never heard of it, and some doctors that did hear of it didn't use it.
Yeah.
And I'm like, well, why not? The thing that I heard from them was, we save it for last. And I'm like, well, what? Okay, well, you got to tell me what that means. What does that mean? Even back then I was asking the question, right? And I was like, well, what do you mean save it for last? Well, conventional, interventional pain management is procedures, steroid injections in the spine, ganglion blocks in the spine, right? Joint injections. It's either going to be steroid injections for pain, or it's going to be hyaluronic acid injections for joints, like in the knees.
Yeah.
But the only reason they put HA in your knees is because Medicare will pay for that one, but they won't pay for it in other joints. So they pay for it in the knees. So everyone gets HA in the knees because the doctors can do that one. And insurances will cover it too. But steroids across the board, they get paid for, doing steroid injections across the board. In the world of stem cells and regenerative medicine, you got a whole field of doctors trying to push that whole envelope of stuff, but it's not covered yet. So all that stuff's very expensive. It's all out of pocket, and it's great.
But all that seems very, invasive versus what you're doing. It seems like why don't you start there?
Yeah, look. My whole mantra has been like, this should be the first step in pain management.
Yeah.
Like, we should be doing the first step. So the doctors they would say, well, we'd run the course with interventional procedures, we'd run the course with medications, and if those things don't work or they stop working, we know we can do the electrical treatments.
Yeah.
Why wouldn't you start with the electrical treatments, right? And what I found out was that they don't make enough money for the time they spend. Mm-hmm. Right? You need about an hour for a treatment, and so you're not going to have enough time to do so the amount that a doctor gets reimbursed for that, there's a bunch of reasons. I talk about this all the time. There's reasons why a doctor won't do it. One, pain doctor is prioritizing interventional procedures. That's number one. Right? That's where they make their money. If they want to pay the bills, which they do have to pay the bills, they need to rotate patients through and do spinal injections that pay them over $1,000 a pop. That's what they need to do. They'll make good money and they can pay the bills to keep the lights on, right?